So good evening, everyone. Malayali Association of Social Workers in Ontario, MASO, has initiated several activities to support our community in response to the COVID-19 pandemic. We have started a support line where people can reach out for distress support, information regarding government programs, employee rights, immigration, etc. We have been doing several information sessions as per the request from our community, and we already had few sessions. So today we are going to have an interactive session with the frontline healthcare workers about COVID-19 awareness, prevention, and readiness. They're going to talk from a socio-medical perspective, and they are going to talk about major points like how to care if you have COVID or if you have a caregiver, how to handle cases when physical distancing may be a challenge, and they are also going to talk about some resources and tips. Today's session is conducted by Mary Paul, Subha Pradeep, Praveen Worki, and Chris Varghese. Mary, Subha, and Praveen work in hospital, and they are very experienced medical social workers. Chris is a nurse practitioner and an expert in chronic disease management. We are lucky to have you all. The panel is going to do a presentation in the beginning, and at the end, you will have an opportunity to ask questions. Alan George, NASO's Vice President, is going to moderate the session. So welcome, everyone, and I invite the panel to start their presentation.
Thanks, Georgie, and thanks, Maso, for giving me the chance to practice the presentation. We'll go straight into the presentation. We have a lot of information following. So, objectives for this presentation are to review COVID-19 symptoms, risk and asymptomatic infection, to discuss treatment, isolation and precautions to take, how to self-care and care for someone who has COVID-19 infection, what could be the socio-economic barriers and resources, wearing mask in public, what is the evidence, what is the current state of COVID-19 infection in Ontario, where are we at flattening the curve, and next steps. As you might already know, coronaviruses are a large family of viruses which can cause illnesses in animals or humans. There are several types of coronaviruses. Some of them cause mild respiratory infections like common cold, and some more severe diseases like Middle East Respiratory Syndrome, severe acute respiratory syndrome, and the new COVID-19 infection, which led to the outbreak in China in December 19 and then has now become a worldwide pandemic. The common symptoms for COVID-19 infection are fever, dry cough, tiredness, shortness of breath. Some people may experience aches and pains, nasal congestion, runny nose, sore throat, diarrhea, or no sense of smell or taste. There are other symptoms that are being studied, like gastrointestinal infections, dermatological symptoms, and things like blood clotting, so they are under study. For some people who are infected, they don't develop any symptoms and they do not feel unwell. For those who develop symptoms, they are usually mild when it begins and they begin gradually. So most people, almost 80%, recover from the disease without any special treatment, and 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops breathing difficulty. People with fever, cough, and difficulty in breathing should seek medical attention. When coming to the infection, COVID-19 infection in children, we see very lower prevalence rate, about 1 to 2%, but it could be because it is underestimated, or it is difficult to determine with certainty because they have mild infections. So from early reports from China, infections in children appear mild.
Thank you, Mary. Maybe I can take over from here. So I'll just talk about who are at high risk. So you already may aware that people with medical conditions, including heart disease, hypertension or high blood pressure, lung disease, diabetes, cancer, or people with weakened immune system from a medical condition or a treatment, such as chemotherapy. Also, a very high risk group is considered older adults too. Chris, can someone have COVID symptoms, COVID without symptoms? Can you talk a little bit?
Yes, so yeah, patients can have COVID without showing any symptoms. So this is called asymptomatic infection. And when this person passes on the infection to another person, it's called asymptomatic transmission. So currently there is evidence that this is happening in the community, and more evidence is showing that their people are actually transmitting the infection to others when they're in their incubation period, meaning just few days or like 5 days before they actually develop symptoms. So that's a reason why a lot of people should try to stay home as much as possible. And if they do have to go out, try to maintain that physical distancing and making sure you're washing your hands all the time, because asymptomatic transmission is becoming more of a risk right now.
Thank you, Chris. So as we know, there is no specific treatments for coronavirus, and there is no vaccine that protects against coronaviruses. Most people with common human coronavirus illnesses will recover on their own. So the things that you should take care of is drink plenty of fluids if no contraindications are there with any other medical condition, or get rest and sleep as much as possible, and try a humidifier or a hot shower to help with a sore throat or cough. Next slide, please. How we can reduce the risk of COVID-19? Stay at home, as we all do now, unless it is essential. Avoid all non-essential trips in the community. Avoid contact with others, especially those who have traveled or been exposed to the virus or are sick. Clean hands frequently with soap and water for at least 20 seconds. Or, if not available, use an alcohol-based hand sanitizer containing at least 60% of alcohol. Avoid touching your mouth, nose, and eyes or food with your hands. Carry alcohol hand sanitizer when you are outside your home. Avoid touching high-touch surfaces such as doorknobs, handrails, or elevator buttons, etc. We are hearing a lot about social distancing. What exactly it means? It's keeping a distance of at least 2 meters from others at all times. So even if everyone needs to practice that, even if you don't have no symptoms of COVID-19 or no non-risk of exposure or not traveled outside of Canada within the last 14 days. And that's the best way you can keep you and you people around you being safe. For a better understanding, we make it in a presentation with a traffic signal. So what are the things we can do in a green light? The safest things to do. So you can greet with a wave from a distance. You can go outside for a walk or run, bike, walk the dog, but be mindful of the 2 meters distance all the time. You can read, draw, paint, listen to music, or watch a movie at home. You can cook and video chats or group video chats and food delivery services, online shopping, all those things you can do in a safest way. And when you need to be, when you are going outside for grocery, try to do it once a week with cautions and taking up food, attending essential medical appointments. Those are with caution, you have to do it. And the things that you need to avoid is, if you are going to work, then unless absolutely necessary, that means essential workers, then they have to go to work, right? So play dates or sleepovers, coffee dates, all those to avoid. And any non-essential workers coming to your home, like any fixing things, or like try to avoid all those if possible. And avoid group gatherings or playgrounds, PC box, and going to shopping malls. None of them are open now, but and non-essential appointments such as hair and nails. All this, try to avoid unessential things. That doesn't mean that you're not allowed to keep in touch with your loved ones or your friends or family. You can use your technology to communicate with friends, and you can be creative when connecting with your neighbors. You can use your balcony or your friend 2 meters apart from your fence, or you can leave a message on your window or a yard, say, showing your support to the community. And also you can think of others. If you are well, connect with people that you may find at this time specific, especially very stressful, like seniors or those who are chronic health conditions, or people having anxiety or depression, or they are maybe heavily impacted due to their job loss or health concerns, or they are separated from their loved ones. And people who are also, you may get some questions from your kids, talk to them and empower them, your kids, to wash their hands, or coughing, sneezing to their elbows, and physical distancing. They may feel a little bit anxious around the whole situation that they cannot go outside. So encourage them to ask questions and use plain language to make them understand. Mary?
All right, thank you, Shubha.
Thank you, Shubha. Now, our next presenter, Mary, will be taking the lead. Mary? Can Mary hear?
Okay, right.
So there are some people who are at small risk.
Sorry about that. We have some technical difficulties right now. We'll work with Mary to.
Yeah, can you hear me?
Yes,
Yeah.
Mary, go ahead, please. Yeah, please. Can you please repeat what you have mentioned, because we didn't hear the whole.
Yeah. You can hear me, right?
Yes. Yes. Thank you.
Yeah. Can I continue? Can I continue?
Yes,
Yes.
please.
Hello? Hello?
Yes, Mary, please go ahead. Sorry about there's some technical difficulties going on when Mary is doing the presentation.
Yeah, so we have some people. We have some people who are at higher risk for COVID-19. Yeah, so we have some people who are at higher risk for
Sorry, again, we have some technical difficulties going around. Sorry about that. We apologize for any inconvenience.
Can you hear me?
Okay, Mary, we still have some issues hearing you. Can you please?
Hear me? Sorry.
Mary, I think your internet connection is, dropping or not functioning very well.
All right, maybe I can just quickly go through.
Yeah.
So social and economic circumstances that may cause someone to be vulnerable to COVID-19. So that includes anyone who has economic barriers, difficulty accessing transportation and medical care or health advice, and unstable employment or inflexible working conditions, insecure, inadequate, or non-existent housing conditions, ongoing specialized medical care or need specific medical supplies, social or geographic isolation, like in remote and isolated communities, difficulty reading, speaking, understanding, or communicating, and ongoing supervision need or supports for maintaining independence, difficulty doing preventive activities like frequent hand washing and covering coughs and sneezes. So this is one of the social and economic circumstances individuals vulnerable to COVID-19. So, Mary, are you able to hear? Right. Okay. So I'll continue. So,
Praveen, please continue.
all right. So there are a lot of resources available to help our community from government and the Canadian government, provincial, and also the local community partners. And so mainly resources available, mental health resources, Canadian Mental Health Association, and many other providers, Canadian Addiction and Mental Health, CAMH. So many organizations, they released and uploaded many documents, resource to help with patients experiencing mental health crisis due to COVID-19. And in our community, we have free grocery delivery services, also medication delivery service, income support services. So you see CERB and other government programs, employment insurance, and also the support services for seniors. So helping our seniors to manage independence and manage their care in a community. Voluntary organizations, for example, NASO, they have a helpline to support our students and also individuals experiencing crisis or need counseling support, education, and we are providing one-on-one support, and also food bank and community food programs, child care for essential workers, domestic violence resources, resources for homeless people, and self-isolation facilities. So this resource is available with us. If you need more information, you can reach us out and we'll share with you. Okay.
So I can take ours. Can you hear me? Mary here.
Yes, go ahead.
Go ahead.
Yeah, thanks, Mary.
Yeah, so sorry about that. So coming to dealing with anxiety during this COVID-19 pandemic, so it is normal to feel some anxiety in a situation like this because we have never experienced such a pandemic in our life before. So it is very normal to feel some stress and anxiety. So to deal with some stress and anxiety, there are some tips that we can provide you. Take breaks from news and social media, which discusses the outbreak. Get information from reliable sources like public health agencies. Practice self-care. Be kind to yourself. Get enough sleep. Eat healthy, exercise, and do things you enjoy, but keep in mind about following the public health directives. Stay connected to friends, family, and your social supports. Reach out to them by phone, text, or video call. Like speaking to someone whom you trust can really help. Believe me, I have my own bunch of friends whom I talk with. They all work in the hospital, so it is very helpful. Stay focused on what is within your control. Use your healthy coping skills. Think about situations where you had something like you had a challenging situation and how you encountered the situation and how you managed. Have a plan for situations like self-isolation. If at all you need to go, like you need to have safe self-isolation, do you have some space for that? Do you have someone to bring groceries? Do you have medications? Things like that. Take the recommended precautions and seek professional help or formal supports if you are experiencing significant mental distress or it is affecting your day-to-day activities. So there are some online and online supports which are available. So there's one called Connex Ontario. These are for people who are dealing with mental health addictions and a problem with gambling. There's another one called Bounce Back. It is free and it is evidence-based cognitive behavioral therapy. And it helps with people with having mental health concerns. And there is another one for children. That's Kids Help Phone. It's for children and youth 18 and under who need to talk to someone about their mental health. There is another one for post-secondary students. It's called Good to Talk. So if you need more information about it, you can email me as well. So we can provide more information about these resources.
Thank you, Mary. I'll take it from here. So in terms of travel, so anyone who has traveled outside of Canada should self-isolate and self-monitor for 14 days when they return. If you travel with your children, parents should actively monitor their children's symptoms, and children who are self-isolating should stay at home and avoid social gathering points such as community or centers or parks. Contact your primary care provider or Telehealth Ontario at the 1-800 number, and if they experience any symptoms of coronavirus. Next slide, please. People who are self-isolating should not go to work, and workers who have traveled and are part of workplaces that are essential to daily living are able to return to work as long as they do not have symptoms. But this may vary, depend on which institution or which area of work you're working. However, they should self-monitor for a period of 14 days and identify themselves to their employer so that a plan can be put in place to ensure the protection of those workplaces. How we can prevent the spread at our workplace. We all have some policies already in our workplaces, but a common things that you can continue at your workplaces are wash your hands frequently, so with soap and water for at least 15 to 20 seconds for our alcohol-based hand sanitizer. Avoid touching eyes, nose, and mouth, and cough and sneeze into your bend of your arm. Avoid touching surfaces people touch often, such as handrails or doorknobs, etc. Follow infection prevention policies and practices and personal protective equipment as directed by your workplace if you are working in a hospital setting or any specific areas in your workplace you're working. Use appropriate products to clean and disinfect your work equipment such as computer, keypads, or mouses, etc. And also always keep a distance 2 meters between you, coworkers, or customers. Increase distance between desks, tables, and workstations, and reduce the activities that require physical proximity. If you work in a healthcare, you may need to have that, but whenever it's not possible, try to avoid that situations. If you develop any symptoms of COVID-19, separate yourself, go home, avoid using public transit if possible. Contact your public health authority and follow their advice. If you're experiencing symptoms or you're wondering you are exposed to COVID-19, then self-isolate immediately and self-monitor for 14 days. And visit the ministry's website and take their self-assessment tool. Or you can call your family doctor or primary care provider, or you can call Telehealth Ontario at the 1-800 number, or visit the nearest COVID-19 center if you meet the symptoms criteria. Check before you go there. And if you think you need immediate medical attention, call 911. Only necessary calls to 911. Do not call unnecessary.
Thank you, Shubha. So I'm here to talk about how to self-care and care for someone who has COVID-19. So first of all, let's review self-isolation guidelines. Before I go, I just want to review who is considered a close contact. So if you are caring for a person, an individual tested COVID-19, or you're living with someone who has the virus, like in a shared accommodation or basement apartment, you are considered a close contact. Okay, so your local public health unit will give you special instructions about how to monitor your own health and what to do if you start to feel sick and how to contact them. So how to self-monitor. So monitor for symptoms for 14 days after exposure, like fever, cough, difficulty breathing. So we saw that, that in the previous slide, 44% to 99% of individuals tested positive experienced a fever, and 22% to 83% experienced a cough, and 1.3% to 76.2% percentage of individuals experience a difficulty breathing, like shortness of breath. So we need to monitor the symptoms. Okay, so and avoid public spaces where you cannot easily separate yourself from others if you have become ill. Okay, so what if you develop for any of these symptoms? So first step, self-isolate and contact your public health unit and the primary care provider. So I'm going to talk about self-isolation guidelines, 8 steps to follow. So before I go, just reminder again, use soap, water, and or alcohol-based hand sanitizer to clean your hands. So, and when you visit your healthcare provider, avoid using public transportation such as subway, taxi, and share rides. If unavoidable, wear mask and keep 2-meter distance, and 2-meter distance from others, or use the back seat if in a car. Right. So let's talk about how to care for someone who has COVID-19. There are 8 steps. These are the guidelines from Public Health Ontario. So wash your hands often, 15 to 20 seconds, with the soap and water after each contact with the infected person. It's very important. Use an alcohol-based hand sanitizer if soap and water are not available. Okay. So step 2, wear mask and gloves. So when you have contact with the person's saliva or other body fluids, such as blood, sweat, vomit, urine, or feces. Okay, that's second thing to take care. And third one, dispose of gloves and mask after use. So take the gloves and the mask off right after you provide a care and dispose of them in the waste basket lined with the plastic bag. Okay, so it's easy. Take off the gloves first and clean your hands with the soap and water before taking off your mask. It's very important. Clean your hands again with the soap and water before touching your face or doing anything else. And third one, limit the number of visitors in your home, and keep seniors and people with the chronic medical conditions away from the infected person. For example, like individuals with the diabetes, lung problems, COPD, asthma, or heart disease, hypertension, cancer, or individuals with a weakened immune system, or individuals taking chemotherapy service. Okay, and next is avoid sharing household items. Very important. Do not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with a person under investigation. After use, these items should be washed with soap or detergent in the warm water. It's very important to wash in the warm water, and no special soap is needed. Dishwasher and washing machines can be used, and do not share cigarettes. And cleaning home with regular household cleaners, and clean regularly touched items such as toilets, sink tap handles, doorknobs, and bedside tables on a daily basis. And wash laundry thoroughly. There is no need to separate the laundry, but you should wear gloves when handling. Clean your hands with the soap and water immediately after removing gloves. Okay, and be careful when touching waste. So, and waste can go into regular garbage bins. When emptying the waste baskets, take care not to touch used tissues with your hands. Lining the waste basket with a plastic bag make waste disposal easier and safer. Clean your hands with the soap and water after emptying the waste basket. So commonly used cleaners and disinfectants are effective against COVID-19. Okay, so use only disinfectants that have a drug identification number. It's an 8-digit number given by Health Canada that confirms it is approved for use in Canada. and also check the expiry date, okay? So also frequently touch the surface twice per day. That's recommended. Example, including doorknobs, elevator buttons, light switches, toilet handles, counters, handrails, touchscreen surface, and keypads.
Hi, thanks, Praveen. So wearing a mask can help prevent the spread of some respiratory illnesses, but if it is not worn or discarded properly, it can become a source of infection. So if you need to wear a mask, you have to make sure that you clean your hands frequently with soap and water or alcohol-based sanitizer. So you have to wear a mask if you have symptoms of COVID-19 and you are around other people, or if you are caring for someone who has COVID-19 infection. Now, how to wear a mask? So before putting on your mask, you have to wash your hands, as I said before, with soap and water for at least 15 to 20 seconds, or using alcohol-based hand sanitizer. Secure the elastic loops of the mask around the ears, and or if you have the strings, the mask has the strings, you have to tie them behind your head. Cover your mouth and nose with the mask, and then make sure that there are no gaps between your face and. Do not touch the front of the mask while you are wearing it. And how to throw it, like if you finish using that, you have to throw it away. Do not touch the front of the mask when you remove it. Remove the elastic loops of the mask from your ears, and then hold on to the loops and then discard it into the garbage bin with the lid. And then after that, it is important that you wash your hands with soap and water again for 15 to 20 seconds, or by using alcohol-based hand sanitizer. Chris, are there any evidence behind the benefits of wearing a mask in the public?
Thanks, Mary. I'm sure this question is like a burning question for a lot of people. I do see some questions in the chat room as well. So if you look at the scientific evidence, there is actually no demonstrated benefit when the general public wears masks in a non-healthcare setting to prevent the acquisition of viral respiratory infection. And this is because if most likely these people are not using the mask properly, and they're not doing their hand hygiene measures and maintaining the physical distance. So that is the reason why it turns out to be less effective. If you're going to use a mask, it could be potentially beneficial as a source control when it's worn by a person with respiratory symptoms and when physical distancing cannot be maintained. Now, there is variability in effectiveness in terms of the type of mask that is used. So there are now cloth-made mask available. Obviously, that is considered to be less inferior when compared to the surgical mask and N95. But having said that, the recommendation by CDC and the Public Health Canada is to wear the non-medical mask so that the surgical mask and the N95 mask can be preserved for the health workers and the first responders, because the benefit of using those masks is actually in a healthcare setting, not so much in a non-healthcare setting. And this is, again, primarily due to the risk of increasing your infection risk through self-contamination when it's used in a non-healthcare setting. So if there's any potential of potential benefits of wearing masks in public, it is less likely to be impactful when compared to physical distancing and hand hygiene. And in terms of whether you need to have an N95 mask, when you're in the public, you do not need an N95 mask. Even in the hospital settings, when we're taking care of COVID patients, we're only using N95 mask if we're doing certain type of procedures that generates aerosols in the air. That's when we need N95. Now, in the public, it is very less likely that there's going to be aerosols in the air. So it's a droplet infection. So for droplet, you just need a regular mask. You don't need an N95 mask.
Thank you, Chris. So, right, so let's review the stats. So number of COVID-19 confirmed cases in Canada as of April 21st today. So we have reported 37,374 confirmed cases in Canada. So, and 19,319 cases reported in Quebec. That's the highest number in our country. And second highest number, Ontario province, 11,735 confirmed cases. That's as of today. And number of COVID-19 related deaths. So as of April 21st, 2020, as of today, so total number of deaths, 1,728. And highest number reported in Quebec province, 939. And second highest in our province, 622 in Ontario province. Chris, where are we when it comes to the flattening the curve? Where are we actually? Are we there, right?
So it looks like we're almost reaching there, but we still need to be cautious. So our health experts held a meeting yesterday. Some of you may have already seen it. So they are saying that the COVID-19 outbreak has likely peaked in Ontario this week. So based on the modeling that was released on the 20th of April, shows that our enhanced public health measures, such as staying home and physically distancing from each other, are working to contain the spread of the virus and flattening the curve. However, the chief medical officer says emergency measures must remain in place to continue reducing the number of cases and deaths. So it's sort of like, you know, when you start taking your antibiotics, you may start feeling better after 2 days. That doesn't mean that you stop taking the antibiotics. You got to continue taking the antibiotics so that the actual infection can be contained. At the moment, the major concern is in our long-term care and congregate settings. There are outbreaks that are happening in those places. But the government is implementing measures to tackle that. So Ontario, as of now, is trending towards a best case scenario rather than a worst case scenario. While several hundred new cases are identified daily in Ontario, hospitals across the province have not been overwhelmed by the COVID-19 outbreak, which is a great sign. So if you look at this graph, this was presented on that April 20th meeting on TV. The data is current as of the 19th of April. So the numbers will be different based on, you know, the numbers that are reported today. So this graph shows the number of confirmed cases in some of the countries and states. So if you look at New York, you can see that New York is the current epicenter for COVID at the moment. So they, in 1 to 2 weeks, they were having more than 33% daily increase of confirmed cases. So now they're seeing around 20% daily increase of confirmed cases. So they're starting to slow down a bit. Now, if you look at South Korea, they actually started off with the highest daily increase of confirmed cases in less than a week, but they managed to flatten their curve in 2 weeks since it surpassed the 100 cases. And this is because of their public health measures. They were very aggressive in maintaining the physical distancing and contact tracing and testing. So that's why they were able to flatten the curve very quickly. So if you look at Canada, we're seeing around 15 to 20% daily increase of cases. It is on the higher side because of Quebec having higher cases. Now, BC has started to flatten the curve, similar to South Korea. And Ontario seems like it's on its way to flatten the curve as well, with about just under 15% daily increase of confirmed cases. So as we look at these numbers, we need to be mindful that there may be underreporting happening, but nevertheless, the trend is promising. This slide looks at the deaths, the trend in the number of deaths that are happening. Again, New York being the epicenter at the moment has the most cases of deaths, where it was doubling every 2.5 to 3 days. Canada is doubling around every 3 to 7 days. Ontario is doubling less than Canada as a whole. BC and Alberta are doing much better than Ontario and Quebec. This one is a snapshot of what's happening in our long-term sector at the moment. So Ontario has just over 600 long-term care homes. The dark blue shade shows the number of homes with an outbreak. So around 20 to 25% of our long-term care homes have an outbreak. So we went from 14 homes to 100 homes having an outbreak in about 10 days. Now the rate of the outbreak is sort of slowing down. Again, it's because of the public health measures and the government support. They're trying to allocate all the resources to the long-term care sector at the moment. So the next few weeks, we will see how these efforts are paying off. So hopefully there will be less of an outbreak in our long-term care sector. This one is a snapshot of how the cases are. So the blue line shows the confirmed cases of the long-term care residents that have tested positive. The pink line shows the cases for the staff members that are working at the long-term care, and the purple line shows the long-term care resident that have died. So around 25% of the confirmed cases have died, unfortunately. Now, most of these patients may have died at the long-term care because of their goals of care. So if they did not want CPR or intubation, or if they did not wish to be transported to the hospital in case they deteriorated, then their wish would have been honored accordingly. So if their cases were not severe, then they will be treated at the long-term care without being admitted at the hospital. So this is also one of the reasons our hospitals are not being overwhelmed. We're not seeing these cases at the hospital setting because of either their goals of care or their symptoms are not severe enough to be admitted. So in terms of how are we doing from an ICU capacity, so if you look at the red dotted lines, that is the basic capacity that our current Ontario ICU system has. And the purple dotted line is the additional capacity that has been arranged by the supports from the government. So the light blue bars that you're seeing is our worst case scenario, and it's based on the numbers from Italy. So if we were to have an outbreak like Italy, our hospital system would have been exhausted with no availability of ventilators. Now, the green bar was what Ontario predicted in March our cases would look like based on their prediction model at that time. But the pink bar is actually where Ontario is. So we're doing very, very well. We're under capacity and doing a lot better than South Korea, because South Korea is considered the best case scenario. So that's like the dark blue bars. So we're doing well in comparison to that. So in a nutshell, we're doing well, mainly because of all the great efforts done by our government and Ministry of Health departments. The emergency orders and the measures that were put in place are showing to be effective. So what's next? At the moment, the focus is on our long-term care homes because of the outbreak. So the government is providing additional relief and resources to these sectors. They're doing aggressive testing, screening, and surveillance. They're getting support from the public health and infection control expertise to contain and prevent outbreaks. They're training the staff members at the long-term care in terms of how to handle the cases. And they have also mandated healthcare workers from other sectors such as hospitals and home and community care to be allocated to long-term care sector to help support their workforce so that they can respond to the outbreak in an effective way. So we need to continue with our public health measures. So the emergency declaration has been extended to May 12. So all the social gatherings are still restricted to 5 people. The non-essential workplaces, outdoor amenities, public bars, places, restaurants, they will still all be continued to be closed. They're trying to implement the next phase of testing strategy by expanding the testing criteria. They're also trying to extend actions again to the long-term care homes and retirement homes and other congregate settings because they're known to be at higher risk for catching COVID, like the group homes and the homeless shelters. So they're trying to put resources there so that the virus can be contained. So the public should continue to stay home and maintain physical distancing to ensure the province continues to stop the spread of COVID and flatten the curve. These actions are making a difference, and people need to stay the course and stay strong in order to save lives. So these are the expanded criteria. So they've included fever if it's greater than or equal to 37.8 degrees. The immunocompromised were already being tested. The age over 60 was being tested. If you've been referred by public health, you will get tested. They've included the caregivers, care providers. If you're a family member of a healthcare worker or first responders, you will get priority for testing. If you are in a facility that is on outbreak, even without having symptoms, you will get tested. Community members from remote, isolated, rural, or indigenous communities will also get tested. Again, people residing in long-term care, retirement homes, congregate living centers, institutions, prisons, hospices will get tested. If you have evidence of pneumonia on X-ray, you will get tested. Pregnancy is included. Now they included these atypical symptoms such as unexplained fatigue, malaise, delirium, pulse, acute functional decline, exacerbation of chronic conditions, digestive symptoms such as nausea, vomiting, diarrhea, abdominal pain, chills, headaches, croup, unexplained tachycardia, the decrease in blood pressure, unexplained hypoxia, lethargy, difficulty feeding in infants. These are the additional criteria that has been included for our testing strategy right now.
All right.
So in conclusion, we're doing very well. And all of this is because of the collaborative efforts of the all essential workers, the Government of Canada, the Province of Ontario. So they've all actually come together. It's a great way that they've come together to work collectively to ensure that Ontario's healthcare system and healthcare workers are supported appropriately and adequately. So, for example, the government made $304 million available to the hospital, to the healthcare system, so that they can increase capacity for testing, so that more testing and screening can happen through public health, help protect the frontline workers, the first responders, acquire the PPEs and other critical supplies. They've allocated money to the long-term care homes as well for additional staffing, screening, and getting supplies. They are also helping out the seniors in the retirement home with the money. So all in all, these efforts and the recommended public health measures have put us in a very good position. But this doesn't mean that we let our guards down. We still have to continue fighting this virus, but we know that at least we're going in the right direction.
Thank you, Chris. Thank you, Mary. Thank you, Shubha. And thank you, Pravin, for your resourceful presentation. That was very lovely. And quickly, being time sensitive, we're going soon to the questions, who we will be giving preferences, based on the people who asked in the chat box. So first question was from Saumya. She was asking a question, when you go for the grocery, whether we need to use the regular mask or N95 mask. So that was a question asked by Saumya. So if one of you can answer that question, that'd be great help.
I'll take that question. So when you're going to a grocery, you only need a regular mask. You could even just use a cloth mask if you want. But again, remember, wearing a mask can give you a false sense of security. So you may think that you're protected just by wearing the mask, and that is not the case. So make sure you're washing your hands regularly, and you still have to maintain that physical distance. So a regular mask is sufficient, a cloth mask is sufficient as well, but make sure, remember, physical distancing and hand washing are the two key components in making sure you don't get the virus.
Well, thank you. Thank you, Chris. Hope Soumya has received the answer for that question. So we have another questions, couple of questions from Anirudh. Anirudh, please note, being time sensitive, we can help you to answer one of your question. And please email if you have more questions and we will get back to you. So the one question asked by Anirudh is about, are the hospitals and long-term cares equipped with required N95 masks, face shields, etc.? Have we started using rapid test kits? Are there any shortage of PPEs?
So I guess I can answer that question as well. So in terms of supplies, the government has been working very, very hard to acquire all the supplies. So what we've heard as of today is that we have lots of surgical masks available. So we're not worried about surgical masks. We're not worried about hand sanitizers, the gowns. We have good supply of that. The N95 mask is a bit of a concern. So there is a little bit of a supplier issue that is happening with the N95. So that is why we're recommending the public not to use medical masks, because we need to preserve them for their healthcare workers and the first responders so that it can be used in the appropriate setting. So the only concern at the moment is for N95. The hospital settings, and I guess certain other institutions, they have guidelines. So a lot of them are conserving the PPE. So before, if you were able to use the mask after seeing every patient, now you're not able to do that. And the reason is because they're trying to be very conservative. It's a conservative approach so that we can be better prepared if we get hit with an outbreak. And then in terms of the rapid testing kits, now the Spartan Bioscience has received approval from Health Canada to produce the rapid testing kits. But it is the purpose for those kits, they're looking to utilize in areas that don't have access to labs. So somewhere like GTA, because we have lots of access to labs, it won't be available to us. It is only going to be available in very rural areas, or they're even considering to use it in long-term care because of the difficulty mobilizing our senior population to the lab. So those are the cases, areas where the rapid access testing kits will be utilized. But as of now, it is not out and ready for use.
Yeah, thank you, Chris, and hope Andrew is got the answer for the question. So now we're moving to the next question from Samvit. This is got quite
Hello,
question.
is there any chance to ask a question? Hello?
Yeah, go
Is there any
ahead.
chance to ask a question?
Yeah,
Yes.
please. May I know who's speaking?
George.
Hi, George. We have to finish a couple of questions and then I will be calling you. Thank you very much for your patience. So we have a question from Samvit in the chat box, which is a good question. Like, I'm sitting in working between 2 to 3 people in my office. Is it necessary to wear a mask?
So if you're sitting in an office setting, you should have that 2-meter distance. So as long as that physical distancing is being maintained, and if the people around you are not coughing, they shouldn't be coming to work if they're having any form of symptoms like runny cough. They should not be coming to work in the first place. But if they're asymptomatic, as long as you have that physical distance, you don't have to wear a mask. Now, these policies vary based on workplaces. Now, in the hospital setting, they require everyone to wear a mask because of the population that we are working with. It's considered a higher risk. So that's why the healthcare workers wear a mask at work. But if it's like a workplace that is not healthcare related, then you may not need to wear a mask as long as the physical distancing is being maintained. And remember, hand washing, that's the key.
Yeah, thank you, Chris. Next question we have from Hani. She has asked the question that what is the possibility of relapse once the patient has been COVID positive and the chances of being relapsed?
So that data we don't know yet. There are some cases where patients are being reinfected with the COVID-19. They have noticed those cases in China and Italy. But we don't know yet, the actual rates and the prevalence or things like that, we don't know. The theory is that because you were infected the first time, the second time you get infected, your antibodies that were developed in your system should be working, and hence you will recover quickly. when you get reinfected. That is what the theory is, but nothing's been tested out as of now.
Thank you, Chris. Next question, George. Thank you for waiting. George, can you please ask the question? If George is not available, we can move to the next person. I have something. Anybody has? I have some question from Shine. How, he's asking how come the use of same mask ensures safety of patients as well as the staff?
Sorry, what was the question again? How is that?
Asking how come the use of the same mask ensures safety of the patients as well as the staff?
So I think. So at work, so if you're talking about a healthcare, if you're working in a healthcare setting, so there are different levels of masks that are used at the healthcare setting. So there's level 1, level 2, level 3, and then there's N95. So if you're working with a regular patient, you're not suspecting COVID and they're not confirmed COVID, we just use level 1 mask. If we think this is a suspected COVID, then we use a level 2 mask. So the level 2 basically means it has a little bit more. Obviously, the 1, 2, and 3, they have different levels of protection barrier. Level 2 and level 3 has a face shield with it. So with the suspected cases, we use the level 2. Level 3 is sort of like we use it with the confirmed cases. And N95 is when we do certain procedures that generate aerosols, so such as suctioning a patient if they're intubated. Those are the cases that we use N95. So not everyone wears the same mask when they're seeing the patient. So every patient has a certain level of requirement, and that's how the healthcare workers follow.
Thank you, Chris. George, or anybody from the public, if they want to ask a question. George, please go ahead. Hello, George.
Okay. I was listening for more than 50 minutes, so I got some information. Thank you for that, especially Praveen. And my question is, I was last 3 weeks, I'm talking on communicating with the MP, MLA, Bishop, so many association president. My question is, what is the treatment is happening in Canada in hospital or clinic, those who tested positive? The reason what I'm asking, you are talking about the precautions and the procedures, whatever it is, that is also very good. But the thing is, right now I have 15 cases in Malayali community, and some of them they directly do the test in walking through, and then directly you can go home and isolate. If you are positive, we will let you know by tomorrow. So they are not asking what is the facility you have at home to isolation or quarantine, whatever it is, 1 bedroom, 2 bedroom, whatever, and what is the physical status of the patient, they are not checking. If it is worse situation, you can come to hospital, you can call the number. But it is not the same we are doing in India. They are directly take the patient to hospital and check the status or the physical, and then after their advice, you have to take this tablet. At least that is to be done here. And the second question is there any request or suggestion our community is doing to stop spreading the virus in Canada? Still public transit is running, several factories are still working, some request is coming to stop lockdowning also. So then what is the meaning of this lockdown? Still not yet happened 100%. Thank you.
Thank you, George, for your question. We will try to answer your question for the best. Praveen, if you can help with that question, please.
Maybe Chris can also help me with this. So
I can maybe start off with the treatment component. So in terms of how treatment is done in Canada, Canada is very strict with their standards. So they only provide a treatment if there is evidence behind it. If it's worth it, if there is more benefit, less harm, that is when Canada will approve a treatment. As of now, there is no specific vaccine, there is no specific medication that treats the COVID-19 virus. It has not been found. Government has started funding research to develop these medications. So these are still in its research stages. What happens in the hospital is they base it on how your symptoms are. So if your symptoms are mild, which would mainly mean that you're not struggling to breathe, that is what they're looking for. You're not struggling to breathe, you're not drowsy, your oxygen levels are not low, your blood pressure levels are not low, your heart rate is not too fast. So if you're not in these criteria, then you don't need to be admitted. The treatment is basic rest, isolating yourself. You just have to make sure you're hydrated. You can take over-the-counter medications for pain control. That is the treatment suggestions for mild symptoms, and that is what evidence says as well. If you are severe, so that you are not able to, again, breathe properly and you're showing other severe symptoms, then they admit you. And what they're treating you are for complications that are arising because of the virus. And one of the main complications that arises because of the virus is pneumonia. So for that, they treat you with the antibiotics. If your blood pressure is low, they treat you with fluids, and they treat you with blood pressure, the vasopressors, meaning medications that will increase your blood pressure. If your oxygen is low, they will put nasal prongs with oxygen on. If that doesn't work, then they put you on a ventilator when it's severe case. So that is the type of treatment that is happening here in the hospital. And this is based on evidence. All the hospitals, like the critical care committee, they get together, they look at what the current evidence shows, and they tweak their treatment based on emerging evidences. So right now, so I'm not too sure what is happening in, like, I don't know what tablet is being dispensed in Kerala, but over here, we don't have like a tablet for COVID-19. So hence that.
Thank you, Chris, and hope, George, your answer for your question. We will move on to the next person. We have 2 more minutes, and we will be ending the session. Just to let you know, please do email if you have more questions. We are sorry that we couldn't answer all of your questions, but we'll be happy to answer the questions if you can email to masvocanada@gmail.com. So I'll be waiting for, okay, we're almost time, and if you have any more questions, we have 1 more minute. Otherwise, it's time for ending the session. So thank you all the resource persons, Praveen, Mary, Shubha, and Mary. And I thank, on behalf of MASVO, I thank all the viewers and people who came as to join this session. I hope the session was useful and resourceful for you. We were trying to do a lot of sessions for people in regards to distress support, employment, child and support, and support services. So this is our 3rd session going in the community. So thank you for being part of this, and hope it helped you. And please email to masvocanada@gmail.com if you have questions. We are in the social media platforms in Facebook, MASVO, and also other medias as well. So our next session will be with regards to child and parent support. Will be going on this Saturday at 8 o'clock. Come with more information. Stay tuned. So thank you, everybody, and have a great night.
Thank you.
Thank you.
Thank you so much. Thanks, Chris.
Thank you very much.
Thank you, everyone.
Thank you.